Alrighties, welcome to Us in the Game podcast, episode 21. I'll say that again, episode 21, guys. Trust, we can officially say we are Karas by day and Codpasters by night.
We've made it. Most podcasts don't make it past 20. Here we are, 21. So drinks on us tonight, I guess.
Damn straight. And I can't think of a better episode to kick us off with 21. So today's episode is a really interesting one because we're stepping into a bit of an unusual one for us in terms of where we've been sitting with a lot of the previous episodes, so looking at performance and the injury conversation. And we're going back, right back, very much back to pediatrics. And we're joined by the wonderful Dr. Jacqui Bunge, a pediatric chiropractor. And the goal of today is to really understand what pediatric chiropractic is, how it differs from what we typically see in adults, and how early intervention might actually shape long-term health performance. So without further ado, Dr. Jacqui Bunge is a highly experienced pediatric and perinatal chiropractor with over 20 years in practice. She holds a master's degree in chiropractic from the University of Johannesburg, represent, with extensive postgraduate training in both pediatrics, neurodevelopment, perinatal care, and sports, and is also a certified lactation consultant. Alongside her clinical work, she's a multiple-time Ironman finisher and Comrades ultramarathon runner, and the founder of Cycling Beyond Boundaries, a project focused on creating inclusive movement opportunities for children with special needs. Jacqui, from myself and Tris and the entire ATG family, welcome and thank you for making the time.
Absolute pleasure. It's so excited to be here. This is literally my favorite topic to speak about. I can speak all day, but get me to speak about babies and boobs and mums and everything that goes in between it's lots of fun.
Exciting to hear. Now, Jacqui, before we even get to what this episode's all about, I have to address something that I picked up immediately when you sent me through your CV. How the heck did you balance all those sporting endeavors while still clearly being such a devoted practitioner?
I have no idea. I mean, it's 21 years, so you've got to fit something in some way.
Geez, I reckon you did more than just fit. I mean, couple comrades, couple Ironmans, that's a lot.
Great number.
Insane. That is, I take my hat off to you. Haven't ever done anything along those lines, but just treating all the people that I do, I know what it takes. And to do that while still being so devoted to the craft, that's incredible, Jacqui.
Yeah. It's sometimes just to get your mind on something else. Working with kids and working with special needs is hard. Working with families can be quite stressful and tricky. So just you go out for a run, go out for a swim, and just self-care is important when you're doing everything that you do.
Yeah, you have to decompress. I mean, we had an episode really on that topic a few episodes ago, and the importance of that and the feedback that we got from other practitioners kind of saying we've had this experience. So I think a good place to start today, because I think this is probably where most people listening are at, is just understanding what we're actually talking about here. So when people hear chiropractic, they usually think about adult pain, backs, necks, but when it comes to babies and kids, it's obviously a completely different conversation. And we're not just dealing with the same tissues, the same loads, I guess even like the same goals. And I think there's also a bit of confusion. Some people see it as very hands-on treatments, and then others think it's more about like development, movement, and even just maybe checking that things are progressing the way they should. So just to ground us, Jacqui, what is pediatric chiropractic, and how would you kind of explain it to someone who's never come across it before?
So we are focusing on neurodevelopment and nervous system function. So it's not, a baby can't say, listen, I'm sore over here, can you fix me? Right? So at birth, you're born with all the raw materials to adapt and learn from your environment. Let's say you've got a little tilt and a turn, so you've got a torticollis, you've got a tight neck. So if you see how I'm sitting, if I tilt my head to the left, turn to the right, I can only see my right side of my body, right? Which means every time I move, I get feedback from my right side of my body. The problem with that is you're only then developing the left side of your brain. So if we are seeing babies from the moment they're born, from the moment actually preconception, if we're seeing them in utero, giving them the space and in a mum's tummy to actually grow and move, how you move matters, and how you move actually shapes your brain. So when we are talking about pediatric chiropractic, we're looking at how they move, how their whole system functions, reflexes, alignment, just because of how that can affect brain development. It's more preventative and supportive as opposed to pain-based. I mean, a lot of people will bring their babies for colicky, refluxy symptoms because literally the only way a baby knows how to communicate is to cry, right? That's the only way they can speak to you. So what they're saying is what we're trying to work out. Whereas, like you said, adults is primarily pain, dysfunction, and degeneration, back pain, neck pain, headaches, etc., sporting injuries. We also look at them differently, so you assess them differently. You watch how they roll. You don't just say, are they rolling? How are they rolling? How are they crawling? If you're crawling on, I mean, it's supposed to be all fours, right? So if you're crawling on both arms down, one leg down, and one leg up, that's not okay. Some of that wiring is gone. You can't build a Lego set just guessing what goes where. There's steps. There's literally, it's a step-by-step process. Everything builds on each other. So if they're not doing a movement properly, why aren't they doing that movement properly? So for me, breastfeeding is your first milestone. If you can't breastfeed, give me a bottle, I still can't latch or suck properly. I can cheat on a bottle. Mum will scream at me if I bite her boob, but I can bite a bottle and get the milk out. So, looking at babies, trying to figure out what they're doing, why they're doing, and what's going on is loads of fun, really.
Quite a skill. I mean, as you said, the non-verbal. I always joke with my patients when they bring up the pediatric chiropractic or even animal chiropractic, and I say, my rule is if my patient can't tell me where it's sore, if I'm hurting them, like I don't want to, that's why I don't treat babies. But it's such a, I think, underrated skill, first and foremost, to kind of pick up on those nonverbal cues. Of course, there's training and learning throughout as you said, you've been in this game for quite a while, that you put in the effort, but it's also like that, like almost like untangible things that you just kind of have a feel for. And if you're passionate about it, you develop that.
You got to watch how people move, which is what you're going to do with your adult patients as well. How they get up off the chair in your waiting room, how they walk across to your room, and how they then sit down in that space. Not just what they're telling you, but also what they're not telling you. It's the same. It's trying to work out exactly what you need to know. Because, I mean, your case history and your observation, especially in pediatrics, I always say that's like the source. That's everything that you need. If you can get that right, the adjusting, which is obviously low force, gentle, specific, catered to whatever size ped that you're treating, comes second. You've got to be able to figure out what you're treating and why you're treating and what's wrong. That is which is the crux of matter of chiropractic anyway, like getting to that primary subluxation.
You mentioned, it's something I get asked quite often, Jackie, if I'm ever referring to a pediatric chiropractor, because Tristan and I share this in common. Babies tend to terrify me just a little bit. So I tend to entrust them to someone else who's very much specialized in that field. But I often get parents that will then ask me that. They said, because they've treated by myself or my colleagues, and over and above, obviously, the basic principle of pediatric chiropractic, the first thing is my little one going to be adjusted? Is their neck going to be clicked? And it's a common question that I'll get. And I'd love you to kind of just walk us through the difference in terms of when it comes down to that principle that you might get from different ages, from like a toddler as they kind of grow.
So it is the first thing I always say to parents. It was strange the other day. I actually got a call and I was chatting to the mum and she's like, do you click babies? I was like, absolutely not. And she's like, well, can you refer me to somebody who clicks a baby? And I was like, absolutely not. It's very gentle, it's very specific, it's very low force. It's kind of the pressure you put on your eyeball. It's, when you go into Woodies and it says don't touch the avo, and you kind of want to just get a little feel of the avo to see if it's right, that's the force that we're using. You're not there. I think mums and parents are scared, but at that stage they're so desperate that they come in anyway. They're scared that their babies are going to cry through the session, and they're quite surprised when they sleep through the session or when they just chill through the session. So it's quite nice to see that mindset change. And, you see the first baby usually, if it's a first-time parent, now it's getting a lot younger because I've done my lactation. I get babies in a lot quicker, but I used to get them at like 4 or 5 weeks. Now I have the mums. I literally had a mum the other day. She's like, I'm going in for my season now. What time can you come and see me at the hospital to check my kid? I was like, let me know when you're home. And then we can check your kid. Just have your baby, sort everything out, and then we can see you. So, once you've seen a baby, once you're treating that family, through pregnancy, through their first baby, they usually then bring their second baby into you straight away. So if it was a traumatic experience for them and for their baby, they wouldn't be there on day 2 or day 3 of treatment, of birth, of life, really, when their babies are earthside.
Yeah. I think people often forget that, birth itself is quite a physically demanding process, not just for the mother, but for the little one as well. It's not exactly a gentle introduction into the world.
Yeah,
So,
being hard work.
Yeah, absolutely. I'm not speaking from personal experience, but from all the moms that tell me, they say.
At one stage of your life.
So, again, a common question that I often get is in these early stages, so little ones essentially just being born, if there isn't necessarily like telltale signs that a parent is necessarily picking up, especially a new parent, they don't necessarily know what to look for. Like they always ask me, little one seems to be happy, but is there something that I'm missing? Should I just take them in for a checkup? Like, what is your advice to a parent when it comes to that in terms of, they often ask me, cool, there's nothing necessarily that I can pick up, but should I take my little one to a chiropractor, chiropractor, just to like have a look? Is everything okay? Is there things that I should be looking out for?
So, every parent's baby is perfect for them, but we're looking at different things. So a lot of the time people bring their baby for a check because they've had a seizure or whatever it is. And then you find things. You find like, as you dig deeper, and that they have pain while they're feeding, or they feed better on one side than the other, or not winding so easily. Mom can't put the baby down, or any of those sort of things. So some things people perceive as normal may not be normal. They might just be common, just not normal. A lot of moms will say to me, I had pain during my pregnancy. I'm like, that's not normal. Pain is your body's way of saying something's wrong. So sometimes people think what's normal is not quite normal. So when I say difficulty latching, if your baby can't breastfeed, moms always say, I didn't have enough milk. It's not about you. It's about how your baby stimulates your breast. So if your baby's not actually opening their mouth wide enough, able to move their tongue, able to latch and suction that milk out, they're not stimulating you. You're not producing the milk. It's usually a them problem, not a you problem. So a lot of moms will take a lot of self-blame for things that might not be going according to the plan that they had, where actually most of the time it's the baby, not them. So think about a C-section birth. They're coming out usually from their necks, or vaginal birth. We have very few unassisted vaginal births in this country. So unless they're going to something like Genesis or Oxford, or having a home birth where it's completely unassisted, most babies are assisted out. And what would that mean your primary restriction or your primary problem would be? Off a neck, or if they're forcepsed out into that TMJ. Primarily, we're looking at breastfeeding latching issues. And if you can't seal on a boob and you can't seal on a bottle, and you start clicking and making noises when you're feeding, you're taking in extra air, what's that going to give you? A gassy, colicky tummy. What's that going to give you? Reflux. All of those things can be a biomechanical problem. And a lot of moms will say, well, babies cry, or babies can't fart.
That's very interesting how you've kind of broken it down from kind of, leading it all the way back to kind of its origin, its root. A lot of times when I'm, parents are having these discussions with me, I'm kind of like, they're coming with the almost like not the end product, but like the symptom, and being able to hear now kind of how you can just work it back is, I think it's reassuring for me as a practitioner. But I think also as a parent, kind of going like, hey, this is I'm not the problem necessarily, or it's not a bad mother, because I think that's a big thing that I've also seen, online as well, where a lot of people are kind of having these support groups for mothers, where they're feeling like
huge. I mean, it's got its pros, but it's also got its cons. Because I mean, if you look on social media, you see this mom who's going back to gym and she's got a baby and she's got 6,000 liters of milk stored in the freezer and her baby's only 2 days old. Do you know that? Like, it puts these preconceived ideas in parents' heads of what they expected to do. And the problem is we live in a world where your watch tells you when to breathe, when to walk, when to talk, when to get up. We don't actually rely on that innate body, like our body's actual ability to do what it's made to do. Our bodies are amazing. I mean, that mom just made a baby.
Very true, very true. Actually, on that note, one thing we really try and focus on the podcast is just building a good base. And so we're not sorting out problems, constantly trying to sort out problems later on. And as you said earlier on, when you were talking about movement, coordination, the child learning to like roll, crawl, stand, and eventually like run, and those early stages are kind of foundation for everything that comes after that. So from what we see in practice, a lot of adult issues aren't just random. As you kind of alluded earlier, there's like often patterns that have been kind of building over time. Like there's an actual root cause to these things, whether it's in adults, again, poor load tolerance, compensation strategies, movement inefficiencies. There we go, English. So I'm quite interested to kind of hear your perspective on how would like early life care and movement development like influence long-term function and potentially even like performance or injury risks later on.
So if you're looking 80 to 90% of your adult brain volume is developed by 2 years of age. Like your largest increase in your brain volume is by a year. So you've got this teeny tiny baby that's going into a walking, talking human. I mean, by 2, they rule the world. But if you've actually just watched a baby go from this baby that's been born who can't do anything to a baby that can have a conversation with you, like how amazing is that brain? And when they get up and move for the first time, or they get up and walk for the first time, for me, the mind-blowing thing is when they have a conversation with you. Like they ask you a question, you answer them, and then they answer you back. Like all of those movement patterns, it's phenomenal. We become more specialized as our brains are shaped by our early development. So let's say you're a W sitter, right? Because that is a common thing that we see, a kid that sits with their legs out at the side. So when they're sitting in that position, they're only moving in one plane of movement, flexion and extension, so forwards and backwards. They're actually not moving in any rotation or lateral flexion. So what are you building? You're building one plane of movement. When you're playing sport, when you're moving around, when you're being a human being, you have to be able to move and develop in all planes of movement. If you have a baby who's got reflex, they're stuck into extension. So they do the same. So they're stuck pushing back. They also only learn to move in one plane of movement. They don't learn to move left to right, lateral flexion, rotation, any of those. So they're the ones who battle to then go into crawling. Then they go up onto their toes and they go into standing. So they're not building that core control. Their ribs are flared, those diaphragms are flared. Those guys are going to have reflux their whole lives because they've got heartburn and they're not actually able to activate their abdomen properly because they've got flaring ribs all the time. So it literally is about how we're building those blocks, to get those babies or those little humans to the best that they can be. If there's any tension, restriction, imbalance, it's going to affect how the signals travel from the brain to the body. Less efficient movement, altered milestones, compensation patterns, which is what you're looking at when you go into sport. These kids then are the kids that want to sit on their phones all day because it's easier. They sit in that forward head position. What is the only other generation that sits in that forward head position? You're elderly. What do your elderly suffer from? Dementia, Alzheimer's, memory loss. We need to get these kids upright and moving from little. We need to have them like loving to move and moving freely and moving pain-free. Because that spine is a structure. It's the highway of the nervous system. Everything works between that.
Jacqui, this is slightly unrelated, related at the same time. I literally was asked this question just today. So was treating a mom, and she's got 3 little ones. And she asked me a similar question that kind of spoke essentially about so her little ones have kind of gone through the COVID patch, if I could talk at that. And they're different ages, but through the COVID area, either due to having to do learning online or using iPads and that sort of stuff to kind of do things through lockdown, expand it afterwards. She was talking to me about how all 3 of them are now having to wear glasses, and they're incredibly young. And it's because of that whole short-sighted thing. They weren't spending time outside, all of that. And she asked me if I had seen or heard about that quite a bit. And I subsequently actually have, from other parents, especially kids that kind of went through that COVID period that were, having to be exposed to computers, laptops, a lot more than I think what maybe necessarily generations previously have. And then she asked me, have you noticed anything, obviously a knock-on effect in terms of mechanics? So have you noticed, like, kids, at that age, when did you ever necessarily hear a kid coming in with upper back pain, neck pain related to postural stuff? And I was like, listen, like, I've caught a few, but not really my area. But I was like, I happen to be speaking to a pediatric chiropractor next day, so I shall bring it up for you. So just as a matter of interest, is it something that you've necessarily picked up or not really?
Absolutely. And I do think things like, you guys are a lot younger than me, but back in our day, we used to ride and play and jump and climb trees and do all of that sort of thing. We didn't really have TV or YouTube or cell phones or anything like that. So if you look at my generation, we didn't pick up the hypermobility and the low-toned kids as quickly as we're picking them up now. If you guys look at your chronic pain patients that you're seeing now in practice, they probably hypermobile. They probably had low tone as a kid, but because they were so active, you didn't pick it up because their bodies worked around it. Now we've got what they're calling Generation C. These C curvatures of these kids that are bent over in these cell phone positions. I've had patients that are doing MRIs and CT scans to see what's wrong with their kids because they're having headaches and neck pain. They sit like this, with their head forward, their head chucked in, and they literally look like a C shape. If you sat in that position all day, can you imagine what headaches you would have? The pressure on the back of the neck. It's frightening, actually. So I always try and get my kids to, firstly, obviously, limit screen time. And the parents always say, I'll walk into my waiting room and they'll be sitting in that C-shaped position. No, they don't do that all the time. It's like, yeah, they do. You can see that jaw falls forward, that neck is strained. These kids are going for some serious testing to see what's wrong with them. And they're all coming up with nothing. It's posture.
Yeah, that's wild. It's crazy to think that from such a young age, them already developing. Again, Tristan and I, we don't necessarily focus on that population group, but then treating people in their 20s, 30s, 40s with those sort of issues, to think that they'd already be having those issues that young is just crazy, thinking about obviously what they've got to go ahead of them from sporting and all that sort of stuff, and the knock-on effect that they could obviously have the years to come.
So then they're walking into sport, right? And you're going into a school where sport's a massive thing, and you're getting there at 6 o'clock in the morning to swim, and then you're doing a whole day of school, and then you're playing hockey after school, and then you might be going to extra hockey lessons or extra swimming lessons and getting home at 6 o'clock, and you're wondering why you're always injured. Because you actually haven't developed that core or that baseline of like support. Yeah, it's wild. I wish I could just make our kids more active.
Movement is medicine. You keep coming back to that same.
And movement matters. How you move matters. It literally shapes your brain.
Yeah, absolutely. So Tristan and I have spoken a lot on this podcast about how we feel it's very, very important, especially within our space, to open the evidence-based approach when it comes to healthcare and indeed within our profession. So I think that's really important because when I get asked this involved with chiropractic, when it comes to, the evidence behind what it is that we do, how we approach certain things, etc. I think it's really important to highlight both the role of like clinical experience, patient-centered outcomes, but still acknowledge necessarily what the research on that particular speciality may say. Using that as a foundation for good clinical practice. When pediatric chiropractic, again, no secret, Tristan and I are very, very limited in terms of our understanding of all of this. Hence, I'm so excited to obviously have you, but I'd love to have your kind of take in terms of where the pediatric world is in terms of research and that sort of stuff at the moment.
As with sort of, I think if we look at most of medicine things that are tested, nothing is really tested on children. So to get those powerful evidence-based randomized control trials, you've basically got to either treat one section and not treat the other, which ethically becomes an issue. We had done research years ago, sort of along the ethic lines, I think we would have had better research and better outcomes, but we do have limited research. But there is a lot of great research coming out at the moment because of degrees at Logan University, at the ACC, and Dort Blatt in Australia, who runs specific conferences to make money to do research. But if you look at I think it was a 2015 review they found that serious adverse events in children were rare. Okay, so, I mean, we're not doing any sort of rotational force adjustments on these children. Your biggest concerns come when we're not picking up the diagnostics. So you just don't want to miss something else that could be happening. So I always say to people, case history, your examination is your first important part. I had a little one come into me last week, Wednesday, and luckily I work in the same rooms as a pediatrician, and I called her in and I was like, this breathing is not great. Can please have a look? And she's like, yep, rib recession, that baby's pulling in completely. And we sent him to the hospital and he went straight to the hospital. I didn't treat him. He was admitted for respiratory distress. I mean, we need to know what these are. Whether, in any population, we need to know what the red flags are that we're looking for. Are we actually, we're not cutting down, just because we're treating kids doesn't mean we're doing a shorter session or anything like that. We are doing a full case history. We're talking to those parents. We're figuring out why they're here. When did the crying start? I had a colleague of mine whose daughter was, I think, maybe 4 or 5 weeks, hadn't cried before that, and all of a sudden started screaming. Rushed to the hospital, and they're like, no, it's colic, go home. She then went to another hospital, and her child had meningitis. Crying doesn't mean just colic. We need to know the differentials that go with crying. If you're looking at us, it's still poorly understood. I think even us as chiropractors poorly understand what the magic is that happens when we actually adjust a joint, when you actually put your hands on a patient, when you actually listen to what a patient says. The more in tune you are to that, I think the better you are at your job.
On that note, we were mentioning now things that you as a chiropractor are checking. Because we're always obviously trying to add value to the podcast, and what should parents be looking at while their kind of child's developing, and at what point do they need to kind of get a professional like a chiropractor involved? Like, what are the oh, listen, this is a red flag or an orange flag, or look out for this? As you said, obviously there's different types of crying, but should a parent kind of be able to pick up on these things? What should the parent be able to know?
So I think throw away your axe and throw away your watch and actually listen to your gut instinct, because parents know. Do not, if a mom walks in here and says to me something is wrong, the hair on my arms actually stands up because something is wrong. And if the first person doesn't give you the answer that you expect, go to somebody else. Go to somebody who'll listen to you. literally your gut instinct. Your baby was inside of your body. That is now a piece of you that's on the outside of the body. You know exactly what's going on with your kid. You know when something's wrong. You've got to listen to your gut, because as human beings, we actually forget that, like, when somebody walks in or you meet somebody for the first time and you get that feeling in your tummy and you're like, oh, I don't know if this is the right person. You've got that instinct as a human being. We've just got to listen to it. A lot of it is not just skill. It's actually just being human and remembering that we're still human and remembering how amazing our bodies are.
Yeah. Jacqui, just going back to what you mentioned about, when we were speaking about the evidence side of things, and you're talking about, someone comes in having that correct assessment to go through diagnostic to make sure, first of all, are they in the right office? Do I need to possibly be referring out? Am I looking for the red flags, etc.? Are they a candidate for the treatment that I'm about to provide? I'm so glad that you said that, because the previous episode we actually had, we spoke about essentially the risks versus reality, what actually happened in chiropractic. We often get, not necessarily criticized, but it's a conversation people often bring up within our office. I'm pretty sure you get the same thing, where people will talk about things like manipulations, and then we start to look at adverse events that can possibly occur with them. And it's a common question that we often get. We literally spoke about all of that in the previous episode. And it's actually one of the comments that we got about it was, does this expand onto pediatrics? So I'm glad that you brought that up, because it largely came down to the same thing. We were talking about, understanding, because when the conversation comes in, is this necessarily a safe treatment or a risk-free treatment? And the whole thing that we came down with is, listen, healthcare is never risk-free, but the whole thing comes down that having the correct clinical acumen to go through the process to make sure that the patient's in the correct office and that they are a candidate for the treatment that I'm possibly going to prescribe, and if not, what other avenues can we look at? And that falls down obviously to the professional, the training that we go through to make sure that we can obviously provide the correct treatment protocol going forward. And also, say again?
Or correct referral.
Yep, absolutely that. If they're not in the right office, cool. Who can I send them to that can then make sure that they get the treatment that they need?
I think there was an adverse effect on a patient walked into an office in the States, and she was actually having a stroke. She had gone to the chiro because she wasn't feeling great. She had a headache and she had a stroke in the office. He had picked that up in his assessment. She survived. Obviously the paramedics got there, took her, and the first thing they said when they got to the hospital was she was in the chiro's office. But thank God she survived. And she was like, actually, I was in the chiro's office. I literally was walking through the door. So, as long as you know and you're doing your job properly and you know that you are looking for those red flags, you're asking the right questions, and that patient is your patient, then you can continue with care with confidence. There are some patients I don't treat. There are patients that I refer. I'm really lucky. I literally just message the ped and say, if you've got 2 minutes, can you come and have a look at this for me, please? And she pops across, and vice versa. So that's why, for me, especially in pediatrics, to have your team of people that you work with makes it a lot easier. Working with somebody else or with other professionals, knowing what your role is, staying in your lane, and knowing what everybody else's role is, so that if somebody comes in, you can say, what the best possible care for you right now would be is X, Y, or Z. I mean, chiropractic for me is always amazing. And I think we actually underestimate the power of chiropractic, especially in South Africa, where we are very much mechanical based. And we've got a small portion that are more neurologically based. But I do think that we don't realize how amazing our career is and what the changes that we can make in people's lives.
Yeah, I do think that it is changing drastically, in the sense of, I think not only the profession is growing, but other professionals, with exactly what you mentioned was actually something I was going to bring up, which I'm really glad to hear. I see interprofessional practice growing a lot, where you see now chiros interacting with physios, bios, neurosurgeons, surgeons, peds, you name it, whatever necessary circles you're swinging in. And it's great because then naturally they get to work with us. They get to see what we do, how we approach certain things.
And understand what we do.
Yeah, absolutely. Yeah.
We misunderstood a lot of the times. I mean, I don't think I've ever worked in a only chiropractic practice. So from the minute I started, I actually started in sport. And then I moved backwards. I went into peds and then I went into perinatal, But I've always worked in multidisciplinary. It just is what, it works. It works best for the patient. And we're not a +1. We're part of that team. We're a big part of that team.
That was a very diplomatic answer when you said you went back to peds. I appreciate that. On this whole multidisciplinary.
I used to do sport, but now I'm cool. But it's fine. I won't say that yet.
You know what you meant. On that kind of talk, I'm just trying to again kind of pull some practical stuff out for like parents potentially listening. And I don't want to reduce pediatric chiropractic to purely just triage, but what would be like do we still use pediatric chiropractic as like a primary care physician, and you as a specialist in that field then goes, listen, this is a pediatrician situation or an emergent situation or a chiro situation, or do they still go GP, pediatric chiro, or do they go pediatrician then pediatric chiro? Like what, more or less, what would be if there's a parent and you've got like 5 things or 3 things or whatever?
We luckily are seeing patients. My new practice that I've opened is actually in a birthing center. So we're seeing those patients right away a lot of the time. If there's a latching issue I have parents who will phone me on their way home from the hospital. Jax, where are you? Can I please bring my baby to come and see you? We're really battling with latching. So I'm seeing babies at 3, 4, 5 days old. That's before the pediatrician. That's before the nurse. So the ped that I work with sees them usually at 10 days old, and the nurse that I work with as well is also 10 days old. So a lot of the time we are the first person that they come to. And because you're sitting there and my consult is at least an hour, because I'm sitting there and I'm actually spending the time with them, and I might have seen them during their pregnancy and I might have seen their previous kid, you land up being their person. They're going to pop you a message and say, this is what's happened. Where do I go? And that's in the special needs realm as well. Like, as soon as you've got a lot of my special needs kids I've seen since they were babies. They've been with me their whole lives. I'm not going to give away my age, but
Let's say 29 with a few years experience on the CV that we got. So.
Something like that.
But again, on that multidisciplinary thing, I've next to me, I've got a podiatrist and a GP that have both been in practice in this location for 30 years. So, it's just that kind of, had a bit of a weird one a few years ago where the patient kind of walked in. I was like, oh, as you said, trust your gut. And I was like, oh, something's not up. Just do me a favor, just, walk with me across. And I think, as you said, it's so beneficial to the patients, and it's not really about us or our egos necessarily, but what we can do for the patients. And sometimes it is as simple as knowing when to refer.
Yeah. Yeah. And who to refer to quickly.
Yeah.
Because if we know what we do well, then we know what everybody else does, so you can actually stay in your lane.
Which is a tricky one, I think, for a lot of new practitioners and chiros, because for me as well, starting out, you kind of not sure, you want to not be a cowboy, which you want to be a rock star for your patient, but you also need to kind of know where your limits are, and obviously with time and experience, you'll find it out. But having I think a multidisciplinary team, especially now with the babies from foundation phase, and again, as you said, the movement is medicine, even from foundation. If you're crawling in a weird pattern, only turning to the left. That's the only thing I remember basically from pediatric. The patient always crawling to the left. I was like, that's a problem. I don't know what it is, but it's a problem.
It's not look right. If it doesn't look right, probably not right.
Yeah.
You just got to It's with adults as well. You got to see enough people to know what's normal and what's not.
Exactly. And this was incredibly informative. Truly it was. I've definitely learned some things. I've got some pearls of wisdom that I'm taking into practice tomorrow morning. And yeah, I really wanted to thank you for your time. And Andy, I don't know if you want to add anything else, but Jacqui, where can we find you on socials, location wise? What is the best way to contact you?
We have grown Pediatric Chiro in South Africa exponentially. I think we're in our 10th year of Pediatric Chiro Africa, which is amazing. I know, guys, I get goosebumps every time I think about it. We had our first meeting in my practice. I've been there for 17 years in my practice, and there were like 20 of us. Now we have over 250 members around South Africa and Africa, actually. So we changed from Pediatric Chiropractic South Africa to Pediatric Chiropractic Africa. So you can have a look. There is a socials for Pediatric Chiropractic Africa, Instagram and Facebook, and then mine is ChiroKids. So yeah, Instagram and Facebook. But otherwise, just pop me a message. If I miss it, message me again, because I get a load of messages every day. I'm usually pretty good on my phone, but if I'm not, just send me another one.
Just spam it until you get a reply, basically.
Keep irritating me until I'm like, okay, I'm here.
Your practices are located obviously in Joburg.
Bryanston, Bedford View, and then Saxonwold, which is Genesis Clinic. So Genesis is a birthing center that's just reopened, and I think it's what we need. I think we need our babies to be born via non-instrumentation birth. When I did my research for my my master's through the AECC, which is the UK, I had no colicky that were not born with interventions. Every single one of them, whether they were C-section or natural birth, vaginal birth with forceps, I had no non-intervention births.
Jacqui, just before we let you go, I think you alluded to it earlier. This is actually just for my interest. Is there like a link that they've drawn necessarily why they think that is the case? Why colic might be necessarily related to reflux, that sort of stuff coming in with people that necessarily didn't get a natural birth?
So I think we're one of the few countries in the world where C-sections are elective. It's us in Brazil, I think, is the other one. But we don't have the confidence in our bodies anymore. I literally think we don't trust the system. We don't trust how we were made.
Back to basics at the end of the day. Again, thank you very much, Jacqui, for your time. Won't keep you too long. And just from Andy on our side, again, thank you. And to the listeners, we're always open for more topics. Send us messages. If you've got messages you can't find Jacqui, message us. We'll get the message to her. And yeah, stay tuned for the next episode. Cheers.
Well done, guys. You're doing a great job.
Thanks, Jacqui. Thanks for coming on.
Pleasure, anytime.